Welcome, welcome, everyone. I'm Dr. Katie Woodley, the natural pet doctor, and I am so excited today about this webinar. So as I'm giving everyone a minute to jump on in, I would love for you to share where you are joining us from around the world, because I know we're reaching across the globe with pet parents, which excites me so much. So drop in that chat box where you're joining from today so I can shout you out, and we'll give people just a minute. I'm going to go ahead and share this on our Facebook to help other pet parents. Michigan, Dina, Mount Vernon, Washington, Jill, Michigan, Anna, Chicago, Deborah, Tucson, Brian, Roenick. Oh my gosh, I see Annie from Wellington. I went to vet school in New Zealand. So that's really exciting. Nicole, Canada. Bruce, good to see you, Bruce. I just saw you guys. Love that you're here. Stephanie, Brazil. Oh my gosh, I love all of you so much. I'm so excited for you to be here and join me for this amazing masterclass that we're going to go through tonight. Wherever you are, maybe it's morning where you're at. I see Washington, Felicity, Joy, Virginia, Veronica, good to see you. Dallas, Teresa from Ontario, Tony, good to see you again. Montgomery, Stacy, Missouri, hopefully I said that right. Mississippi, Los Angeles. Oh my gosh, I love this. All right, let me get this shared over here. And I would love for you guys also to share too, because we're going to be talking a lot about some cases and going deep on root imbalances. And I would love for you to share, what is the biggest concern that you have? What do you feel like, what is kind of like keeping you stuck, like keeping your pet stuck that you just can't get past? Drop that in the comments also. Christine, I see you from Florida. Lucy, Oregon. Katrina, Orange County. Oh my gosh, Dina, meningitis. Oh my goodness. That is definitely a hard condition. I treat a lot of meningitis. Felicity, allergies. I'm seeing Anna, allergies, lots of allergies. Stephanie, allergies. Okay, you guys are in the right place. And I hope you have pen and paper and a notebook for this, because there's going to be a lot of information on why do these things occur. So, all right. Okay, let me get this going on Facebook. All right, we're live on Facebook. Let me get this screen back up where I need it. Okay, I see lots of allergies, GI issues. Welcome, welcome people on Facebook. Good to see you guys. We are just getting started with our masterclass this evening, morning, afternoon, wherever you're at, it doesn't matter. I'm grateful that you are here learning, educating yourself, empowering yourself with the tools and knowledge that you need to really dive in deep and find, why is my pet experiencing these health conditions? So I'm grateful that we're having pet parents join us from across the world. We've got a lot of content to go through tonight, so make sure you grab that pen and paper or a computer to take notes on, and let's get going. I see all of you. I appreciate you guys posting in the chat. IBD, lymphoma, 100% this is recorded, so you can rewatch it. We will be posting that replay a few hours after we finish, so don't worry, Janet, you can definitely rewatch this. Because if you're new here, welcome. If you're returning, you know I like to cover a lot of content. So let's do this. All right. Are you missing the root cause to your pet's health issues? So we're going to talk about how to heal your pets with foundations, not band-aids. And for everyone new here, I'm Dr. Katie Woodley, the natural pet doctor. I'm a holistic integrative veterinarian. So I want you to assess right now. Like, think about it. Think about your pets. You might have one, you might have two, you might have 20, however many pets you have. Think about your pet's health currently. Where are they currently at? Maybe they're itching, they're scratching, they're getting chronic ear infections. You're having a hard time resolving their skin issues. Maybe they are having GI issues. They're vomiting, and here's the thing too, vomiting cats is common, it's not normal. So how often are they experiencing these symptoms? Are you noticing like soft stool? Are they really sensitive to supplements? Are there other concerns going on there? So I want you to take a step back and write down, what is the biggest health concern that you are experiencing right now with your pets while you've been on this journey? And if you feel comfortable enough, drop it in the chat box. I like engaging and seeing what you guys are sharing in that chat box so I can see where you're at. How long have you been experiencing these health conditions for your pets? And I'm seeing a lot of allergies. Now, here's the other piece to this is, think about that journey, right? How many times have you been in the situation where you go back and forth to the vet clinic? You're sitting there, your pets like probably don't enjoy it very much. That unfortunately happens a lot of times, especially when pets have a health condition. And I'm seeing a lot of things where 3 years, sometimes I see patients that are going back and forth to the vet clinic for 12 years. And your vet's doing the examination, hopefully. They're doing hopefully some diagnostics. But a lot of times you leave and you have medications, you have prescriptions, you might have prescription diets. Who here has been there? Maybe you're currently there right now. You get home, you're all excited. You're like, I think this is going to work. We see some improvement. And then all of a sudden your pet is back right where they were, not feeling good, not doing well. And those symptoms are recurring. And you're like, why did I just flush all this money down the toilet, right? And it can be a very frustrating issue where you're going back and forth to the vet clinic, you're spending all this money, and it's just not working. So what do? So then we go in the rabbit hole, right? That rabbit hole, we go online, we start looking, researching, diving into all those Facebook communities and groups, hoping that we find the right strategy, hoping that next supplement works, hoping that food change will resolve those itchy ears, those skin issues. And we start buying things. We start getting all the supplements. And I talk a lot about supplement graveyards because I've been there. And the next best thing, right? Well, Susie said to use this for Tom. It worked for her dog, Bob. I'm going to try it. Like, we got to try it. Let's try it. You try it for a few weeks, then it's not working anymore. And you start seeing those supplements again, and it's just not working. And you're feeling frustrated. You're feeling overwhelmed. You're feeling really alone in this process because it doesn't seem like there's an answer for why your pet is sick. And once again, we end up feeling like that money is just flown out the window now. We don't know what's going on. And unfortunately, so many pet parents end up here where we feel like there's no more hope. Our vets might have told us, like, unfortunately, this is our situation and this is the best that we can do. Who's been in this situation, or who currently feels like there's no hope right now? Like, you raise your hand. You can drop it in the chat box. I promise you're not alone, where you feel like there's nothing left that you can do, or you've tried everything and it seems like there's no other solutions. Well, that's what we're talking about today, because there's actually a new strategy, and it's not that new. It's been around for a long time, but it's new to a lot of pet parents and even veterinarians. And it's going to require a bit of a shift in the mindset and the way that we think about the body and how we view all the systems. And it's all about finding the root imbalances and addressing the connecting areas that are actually causing that true issue, rather than just treating symptoms by following frameworks. So we're going to be going deep into some content. So we want to make sure that you turn off all distractions. Obviously, if you're driving, please don't turn that off. But if you can set aside a quiet place where you can think, this is going to require you to sit back and think about, what are these connections? How do these apply to my pets? And most importantly, how can we apply these frameworks that I'm going to teach you today to your specific pets and the symptoms that you're seeing, to help you truly identify where those root imbalances are? Because here's the thing, modern conventional medicine, they want you to wait till there's complete degeneration, right? But with a true holistic approach, you don't have to wait to take action. You can take action now to get the body back into balance and truly heal it. This is the power of a holistic integrative approach, where we don't necessarily need a diagnosis, but when we understand these connections, the entire game changes. So essentially, we get back to this place where we have hope, we feel confident, we feel supported, we feel empowered, that we can now understand how everything is connected. And I love this quote: the greatest medicine is being able to teach people how not to need it. Like, how empowering is that? We never had to tap into that acute medicine, those emergency medicines ever again, because we truly understand what the body needed and how to allow it to heal itself, utilizing the right types of food, energetics, supplements, herbs, things to fill in the gaps, physical health. Those are all things we're going to talk about. Now, so today, I'm going to walk you through this, how you find this root imbalance so that you can finally heal your pets, regain or optimize ideal health. And I know you might be thinking, right? Like, I've already done everything, Dr. Katie. Nothing works. You may be even asking yourself, like, what am I going to learn here? Like, this is crazy. You've probably gone down the rabbit hole. We've all been there, and it seems like there's no answer that works for your pet. And that's probably why you're here today. And I get it. I have been there myself too. So I'm going to take you down a little path. You might have heard it before, but my husband developed an autoimmune disorder at the start of 2014. And it was a real struggle to find what was causing his immune system to get angry. And I've also worked with a lot of pet parents struggling with this, trying to figure out how to fix their pets too. And they thought the same, there's no way out. But the problem is it caused them to stop due to the overwhelm and the lack of results. And it actually left their pets in a state of poor health. Because I want you to think about what happens if we do nothing. Like, if you change nothing, nothing will change. But here's the thing though. Do you feel like the problem just goes away if we stop taking action? Well, I can actually tell you the problem usually doesn't go away, and actually pets can become more sick because we didn't address the root imbalance, and that low-grade inflammation continued to like brew inside the body and grow and affect other systems. And you may have seen this yourself, and it might be causing you to feel more upset and overwhelmed, and maybe even feel guilty that you couldn't help your pets more. But don't worry, I'm going to give you some tools today. Now, most pet parents, they get stuck in this vicious cycle. I talk a lot about the cycle of the same health problems, giving the same drug or even the same supplement, expecting a problem to be fixed, but their pets only feel better for a few days or maybe months. That same issue just keeps coming back. This is where you're going back and forth to the vet clinic for the same problem, and it's just not working. And the flip side to this is a lot of pet parents are trying supplement after supplement to try to fix the problem, or changing the diet after diet and trying all these different things, hoping the next one works. But it's kind of like having this bucket where we're filling it with water, we're trying to fill it, but there's all these holes in it. And the water is just pouring out of it and we can't get it full, and we just keep dumping in more water and it's not working. We have to fix the holes first. Those holes are those root imbalances. Sometimes we have one, sometimes we have multiple. So for all the pet parents here who have had years and years of health issues, we might be dealing with a couple different root imbalances that we need to address according to the frameworks I'm going to show you. So when you have a bucket full of holes, remember, what do you think is going to happen? We need to patch the holes and fix the actual root issue rather than trying to pour in more and more and more. So holistic pet parents, on the other side, we can feel confident that the root cause is being addressed to address the real reason for the problem, achieve optimal health, and you have the tools to balance and maintain a healthy state without relying on a hope strategy. So I want to ask you, who here wants to be a holistic pet parent, right? True holistic pet parent. We're addressing those root imbalances. We're getting to the root cause. We're not just treating symptoms. I see you guys raising your hands, and I appreciate you. This is why I do what I do, because I've been on that other side with human health, with my own pet's health, and we're going to talk about that. Now, you're in the right place if you are ready for a change in your pet's care. You know there's a better way to achieve optimal health, but you're just like feeling so overwhelmed on where to start. You're frustrated, you're tired of all the vet visits and bills that don't give you the progress, right? Who here is sick of all the vet bills, right? The vet bills that keep coming. And you want to know that you're doing everything possible to keep your pet living a long and vibrant life. You want a supportive community to help guide you on the right path. Gone are the days of being alone trying to figure this out. And you're ready to take action and know that the holistic life is a journey and it can take time. This is not an overnight fix. That's what's so hard about this journey at times, especially when you're alone on it. And you're also in the right place if you're curious. Like if you're new to holistic medicine, you're like, what is this all about? And learning about the different ways that we can actually achieve true optimal health in your entire fur family. And now here's the thing, like, if you were like, that doesn't really resonate, not sure why I'm here, I don't want to waste the next potentially hour and a half of your time. So this is where if you're looking for those quick fixes, you don't care about finding the root cause, this is not the place for you. If you don't have time to take action and appreciate that journey, this is probably not the masterclass for you. If you already think you know everything and not open to learning a different way, this is probably not the place for you. And if you really think there's only one way to look at health and it's either your way or the highway, it's probably not the place, and that's okay. But also too, if you get mad when I give you 60 minutes or more of strategy and our Q&A at the end, that's literally helped hundreds of pets, and then complain when I make you an offer for an exclusive opportunity to work with me, I recommend leaving the masterclass because I'm so excited because I will be inviting you to apply for the Healthy Holistic Pet Blueprint program at the end of this call. So I just want you to be aware of that, get prepped for it, since I am really excited about the transformations we're getting and to see if that's a good fit for this next part of the journey together for you to help your pets thrive and finally fix those root imbalances. Now, I want you to stay until the end for the Q&A. But first, if you're ready and excited, give me that thumbs up in the chat box and let's get going, okay? I'm super excited about this topic. I see you guys are too, and you are my people, I see. So before we dive into the tactics, I'm going to give you a little bit of history of where I've come from on this holistic health journey, because it is a true journey to show you where I've come from, what we've learned along the way, and how we've implemented that for truly helping our patients thrive. So I started my vet career all the way back as a young, naive veterinarian in the beautiful country of New Zealand. And we learned, big brand kibble food was the best for our pets. I started my beautiful soul pup Finn on kibble. Didn't know better. I thought doing the vaccines, the dewormers, all those things were important until we moved back. 6 months after moving back to the States, my husband developed an autoimmune disorder, and it completely changed how I viewed medicine. I'll never forget sitting across the doctor table, hearing those words, there's nothing more you can do other than strong immunosuppressives that don't really work. And not being able to do what we always used to do, spending time in a hospital, really never getting a clear path forward, and never having a partnership with a doctor. However, this was the game changer, and this is where everything literally changed in my life and in my vet career, because I started learning more about an entirely different world of medicine that focused on the root causes versus symptomatic care. And I quickly realized that I could actually be doing so much better for my patients. And so I became acupuncture, Chinese herbal medicine certified, food therapy certified. And of course, I came up against a lot of the same things that you come up every day, potentially. If your vet's not open to these things, it can be very hard if they don't believe that there's another type of medicine out there versus conventional. And so you might be experiencing that right now too. Who here is experiencing that right now, where you bring these ideas to your veterinarian and you just get shut down? It is the worst thing. I've been there personally on the pet side and also on the human side. And unfortunately, I'm seeing too many hands raised. So I totally feel you guys. And that's the thing, like you're trying to do your best, and hearing that what you're doing is not right, may cause harm, or won't make a difference. But this didn't stop at our tests. The big thing is our dog Finn, my soul pup, he was my heart and soul, started having seizures, and we diagnosed a brain tumor. He was actually changed to a home cooked diet years prior when we started this shift down the holistic path. We put him on herbs to help him We actually avoided 2 knee surgeries. So he had 2 torn cruciate ligaments. And by the power of holistic medicine, we were able to avoid those with a 75-pound German Shepherd. You couldn't even tell. It was amazing. Here's the worst part though. When he had this diagnosis of a brain tumor, he didn't do well with the conventional meds that we put him on to help with the brain swelling from the tumor and also the seizures that he was repeatedly having when we first diagnosed him. And I was actually told by the specialist there was nothing else to try, to take him home, to love on him and bring him back, probably maybe in a week if we even had that. And here's the thing though, because of my journey and the path we had been on, there was something else we could do for him. And it was holistic medicine. And we were actually able to give him another amazing year of life with great quality of life when there was literally nothing left on the conventional side. We were told there is nothing more. There were no drugs. I knew that too as a veterinarian. And Finn really helped me realize even more that pet parents are being told every day that there's nothing else you can do or to just wait and see when there's another world of medicine we can use to help your pets now. And so here's the best part. I realized from this experience, our journey, that I can help more pet parents by teaching them online how I helped Finn when he was given a week to live and seeing the results with all of the patients that I've been able to help through these past 8 years. And my husband's life's changed with holistic medicine when we were told there's nothing more you could do other than strong immunosuppressive drugs. And there's this framework for healing health concerns. And that's what I turned my years of holistic pet experience into a program that breaks it down into easy to implement steps. So rather than staying stuck by following the framework we're going to talk about, you can actually achieve success, get your pets feeling much better, not just treat symptoms, but treat those root imbalances. So are you ready to learn more? Keep that open mind. Give me that ready in the chat or just hands up, because by knowing how to use these pillars, optimal pet health is at your fingertips because you're fixing those root imbalances. So I want you to take a minute, think about where is your pet's health currently? And I want you to think about in 1 year, what could your pet's health be in a 1-year journey? And I want you to consider this your fast pass. So take a second. If you have pen and paper or computer, I want you to write down the feelings and the emotions that come up when you think about your beautiful dogs and cats sitting around you, maybe right now, living their best, most vibrant lives 1 year from now. And if you feel compelled to, put it in the chat. What are some of those feelings? What are some of those emotions? Because this journey is not always fast. And this is the thing that keeps us stuck, is that we stop because we're overwhelmed. And we have to tap back into that feeling, that emotion. And I love what you guys are writing. Christine, I see you, pure joy and relief. Joy. Yes. Yes. I love you guys. All right. I see it. Humble. Yes. We can get them to that place. What would it do for you? All right. Now we're going to go into these 5 pillars. There's 5 pillars to achieving optimal health and being able to find the root imbalance. And this seems really simple, and it can actually be, but it can also feel really overwhelming if you're not sure where to turn, especially if you feel like you've tried everything and nothing is working. And these may be new concepts to you if your vet hasn't discussed these areas. So let's start by breaking it down a little bit. I want you to first start with observation. This is easily overlooked, and the goal here is to really appreciate what's working and what's not. I want you to ask yourself, why is something happening? Not necessarily what to give. How many times have you found yourself asking, okay, what do I give for diarrhea? What do I give for itchiness? What do I give for the ear infection? And there's a time and a place we need to treat these symptoms. But if that's the only question we're asking, we're going to miss the root imbalance. So if we shift it, we start asking why does my dog have diarrhea? Why is my cat itchy? Why do those ear infections continue to occur? Why is my dog's liver values elevated? we're going to get a very different answer, which is going to lead us down a better path. And I find a lot of pet parents will get so focused on the trees that they miss the forests. We need to take a step back and see the bigger picture. And if we start honing in on one symptom, this is the problem with conventional medicine, we're going to miss the bigger picture and what potentially led us down that cascade to allowing that symptom to occur. Does that make sense? Kind of broadening that approach, taking a step back, not being so narrow focused. It's a different way to approach medicine. And the reason why this is so important, you may be thinking like, this is an easy answer, right? Like, why is this so important? And I'd love to hear your thoughts in the chat box. Like, however, this is one of my patients, we're going to talk a little bit more about him later on, that came to me with chronic pain for years. Supplement after supplement was tried. He was getting chiropractic adjustments weekly. Nothing was working. And this is a prime example of taking a step back and making sure we weren't missing the forest for the trees and assessing all 5 pillars. We actually found he was hypothyroid. He had heavy metal issues, and not surprisingly, a gut health imbalance that were all impairing him from healing. And his owners had gotten stuck in that vicious cycle of trying this, trying that, hoping the next thing works. So this is how you get out of that hope strategy. We find the root balance and other reasons why your pet's not healing. And we always need to be thinking about how everything else is also connected, and it could be affecting the healing that we're trying to achieve. So physical health, emotional health, nutrition and gut health, environmental health, and immune health. And this is a big difference between conventional and holistic medicine. They are not the same. Conventional medicine tends to treat symptoms. It's very limited in healing root causes, doesn't connect the body systems. Typically, we're looking at one system, limited knowledge in health outside their specialty. We have a lot of experience in the gastroenterology realm because of the autoimmune disease that my husband has, and they could not tell us about skin if we even tried. There's very short appointments. It's very symptom focused, and you have to wait for a diagnosis. It's that whole let's just wait and see, where we're going to just let that degeneration occur until it's a point where now we can actually put a diagnosis on it. Whereas on the other side, which is more of the proactive approach rather than reactive, is holistic medicine, our Eastern medicine approach, which is focused on prevention, but can also support symptoms naturally. We have more tools in our toolbox. We view everything as being interconnected. We focus on asking why is something happening to find a root cause, and we can actually heal without a diagnosis. I do not need a diagnosis to start treatment and finding the root imbalance. Much more empowering, right? And I love this analogy. Like, what do Cheerios have to do with pet health? So I want you to think about if you were to take your baby into the pediatrician, brand new baby, first baby, you're super excited, but also nervous. And you're like, Doc, what do I feed my baby for their optimal nutrition and health? And they plop down a box of Cheerios. They would go, you'd be like, really? And they'd be like, yes, it's fortified with vitamins and minerals and nutrients. You should be fine. Just go for it. Just use that. You should be okay. Well, here's the thing. Veterinarians are doing that. We are the only medical profession that recommends a dry processed kibble diet for the life of your pet. So think about that. We're offering Cheerios for every single meal for our pets. We're not really taking a step back and looking at, wow, does fresh food really matter? What about that microbiome? Are we putting more toxins in? Are we making it harder for them to digest synthetic vitamins, minerals? Do those grains have glyphosate sprayed on them that now the liver has to process? These are questions that I was not taught to ask in veterinary school. And here's some other things that along this holistic journey that can cause a lot of people to fail. It's that time, that realistic expectation. This is truly a journey that comes with ups and downs. And when we start releasing that expectation of time, then it removes the pressure off of you to expect resolution, say like next week with the itchiness, with the diarrhea, and we set realistic expectations. Waiting for a diagnosis to take action. If we're going to just wait and see, it's going to be much harder to heal. We think about if we're at the top of the cliff versus the bottom of the cliff and we have to climb back up to get to the top. Your conventional medicine is essentially the ambulance at the bottom. And we don't want to fall off the cliff. We don't want to wait and see. And the other side to this is we're using natural remedies like conventional medicine. We're asking what to give rather than why am I giving that? And we're missing root causes. So you might be using supplement after supplement because it's supposed to be good for gut health, but we need to be asking, why is gut health off? Why are we using the supplement? Is it truly what this body needs right now at this time? And we're all going to be on the spectrum of health. We're either going to be moving towards health or moving towards disease with every choice that we make. And there's a threshold we have to hit in order to even see symptoms. So when you think about moving on this spectrum, you may not see symptoms until you're at the very end of the disease part of the spectrum. But what if we could fix things before we saw a symptom? If we knew about these foundations and we could heal the body and prevent it from becoming an issue, what would that do for you? So also keep in mind this bucket. Those root causes are the holes. We don't want to just keep pouring in more water and ignore or miss those holes that are allowing things to come out. So how do you find those root causes? It's got to go back to these 5 pillars of health. And we're going to cover them today briefly so that you can see how you can start approaching your pet's care to identify where things may be off and leading to the symptoms that you're seeing. So when we identify the root imbalance, treatment becomes easier, less expensive, and you actually start to feel much more confident that you're on the right path rather than hoping and not really knowing if what you're doing is working. So think about these pillars like a house. We have this house that's sitting on the ground, and hopefully it's a nice solid house, right? But when we go inside, we see a crack. Okay, let's think about the questions we could ask. Okay, what could I use to fill in that crack, right? That's a conventional medicine approach. So if we were to just go, okay, I can just like paint over this crack, that'll cover it, right? This is like treating symptoms with a drug or treating a symptom with a supplement and not asking the better question of why is that crack there? That crack may be there because we have a foundational issue. Whereas if we're missing an issue that's creating an immune system imbalance, say we're using, for example, a flea and tick preventative, a neurotoxin, and we have no idea that it's adversely impacting the immune system, if we just paint over that crack, the foundation's going to continue to crack. So we need to go back to this house and look at the entire picture, the entire ecosystem, looking at that foundation. Is that ground solid? Is there any sagging? Or is there any weakness in this house? And that's how I want you to look at these pillars of health as we go through these 5 foundations. So the first pillar, where everyone goes usually, is gut health and nutrition. And the food you eat can either be the safest form, the safest form of medicine, or it can be the slowest form of poison. I love that quote because it showcases that if we are feeding things like Cheerios, right? So processed food, AKA kibble, we usually don't see a symptom right away. It takes time. It is the slowest form of poison for things to show up in the body. Remember, we're on that spectrum of disease where we're either moving towards health or we're moving away from it towards disease. And there's that threshold we have to cross before we even see a symptom. Now, some of the unhealthy gut symptoms that you may notice: weight loss, dull hair coat, autoimmune diseases, allergies, sensitive GI tract, acid reflux, diarrhea, vomiting, excessive fur balls, hairballs, vomiting in cats, dental disease, bad breath, even if they have clean teeth, inflammation, ear infections, anxiety, thyroid issues. This isn't even the full comprehensive list. The key here is that I want you to realize not all of these seem like they're related to the gut, right? Why are you saying there's a gut health issue if they have a skin issue or an ear infection? And a lot of times when you go into the vet clinic, they're so focused in, they're missing the forest for the trees. They're focused on treating that symptom of diarrhea, and they're missing the actual issue. They're so focused on treating that ear infection with topical antibiotics, medications, Cytopoint, Apoquel, that we didn't even think about the gut. So this conventional treatment tends to be things like antibiotics, a lot of times metronidazole, Flagyl, steroids. Let's suppress it, right? Here's something going on. Let's use a really strong anti-inflammatory immunosuppressive. Let's suppress the heck out of it. And then what happens after the long term, or even maybe the first time you go in? Here's your prescription diet. Who here has a pet on a prescription diet or has been offered a prescription diet in the past year? Let's put it to a year. I'm seeing quite a few of you. Okay. Yep. Super, super common. This is typically the path because this is what we are taught in veterinary school. Now, here's the problem with this is that there are numerous studies now that showcase what this is actually doing to make the problem worse. So metronidazole, Flagyl, same difference. They are the most commonly used antibiotics to treat GI upset. And what happens is that it creates this dysbiosis. It creates major disruptions in the normal intestinal flora, the bacteria that should be living in the gut. And what we've seen is for at least 4 weeks after metronidazole, the last dosage, there are major effects. Not only affect the bacteria, it affects bile acids. So bilirubin, your bile are very essential for moving toxins out of the body through the stool. If we're disrupting that, what do you think is going to happen? If we're affecting tryptophan, we're going to be affecting serotonin, other neurotransmitters. So what's the down regulation of that? What's going to happen cascade? We can see behavior issues. We're going to see inflammation in the rest of the body. We're going to have problems with digesting our food. And this study was only done for 4 weeks. And what we've seen in the human side, because we have more studies, is that we've seen alterations in the gut microbiome that have lasted 4 years after a short course of antibiotics. 4 years. That's incredible. That is very, very important to know about because yes, metronidazole may take the diarrhea away, but what's happening in the long term because it didn't treat the root imbalance. And this microbiome is so important because we have trillions of different microorganisms living in the digestive tract. There's a lot of similarities between cats and dogs. There's a little bit of differences. Doesn't matter. I want you to know that there is this ecosystem that is inside our guts, especially the small intestine and the large intestine. And it's there to break down the food. It's helping to digest. It's producing short chain fatty acids, which are essential for calming down inflammation, providing food sources for the intestinal lining, secondary bile acids, vitamins, nutrients, hormones, neurotransmitters. 90% of serotonin is made in the gut. And it's also maturing and developing the immune system. So even though, as you can see on this slide here, there's only one cell layer thick here of our gut lining, but we've got all this amazing stuff happening up here with the ecosystem, the microbiome. We have a chemical barrier with immunoglobulin A and that mucus layer that's protecting from food, bacteria, toxins passing from the lumen in the gut through that physical barrier where we have this immune system sitting right here, ready and waiting. So imagine if we take out this entire ecosystem, what's going to happen? And some of the possible sources of gut health issues, because once again, the question is why? Why is something showing up? It can be mouth issues, dental issues, parasites, viral, bacterial overgrowth, nutrition, so the food we're feeding, the treats we're feeding, digestion, water, endocrine hormonal imbalances, medications, vaccines, toxins, emotional health, and stress can actually create gut health issues too. And when we look at this, we always want to be asking ourselves better questions. So, is this an acute onset thing? What's the chronicity of the condition? Has this only been going on for a couple days? Has it been going on for years? Is it one pet versus multiple pets? Did it happen after introducing something new? What are some of those symptoms? So, this is going to help distinguish what to remove and what tests to do to find that cause rather than just guessing. One of the cheapest, easiest things that you can do at home with your pets is keep a journal. Have it become part of your habit of just journaling, especially when you start new things, and how they feel, what their digestion looks like, how their allergies are responding. And that will give you a much better indicator of the household changes that are happening and how all of those things are impacting the gut health. Because there's a lot of different things, once again, that affect that microbiome. And we have a lot of great studies that show that it's significantly influenced by the diet type. So whether we're feeding a natural, less processed, whole food, species appropriate food, or commercial, so processed kibble diets, they're going to have a more diverse gut microbiome when we feed less processed foods. Go figure, right? That's not crazy, but now we have some studies that we can bring to the vets to show them, like, hey, this kibble is not the best diets for my pets. We also have to keep in mind too, when we have symptoms, we need to be asking, why should we be using these? Because antibiotics are going to kill the good bacteria. If you are using something like a proton pump inhibitor for acid reflux and your pet's been on it for a long time, like these are meant to be short-term usage, not more than a few weeks at most. And this directly impacts different vitamins like your B12 vitamins, vitamin C, calcium, iron, magnesium metabolism. What's scary about that is if you have a chronic health issue, your pet's already having a hard time with absorbing those, and they tend to be deficient in those anyways. So if we're adding something on, it can impair them even more. Non-steroidals can impact the microbiome. They can create inflammation, stress the kidneys, the liver, cause gastric ulcers, toxins in the environment, which we're going to touch on, and stress, which we're going to touch on. All these things can lead to what we call dysbiosis. Dysbiosis is overgrowth of bad bacteria, leading to an inflamed gut lining. We get increase in permeability. So what you see here is they become leaky and inflamed, allowing bacteria, toxins, all sorts of things that should not be passing food to pass through, get into the bloodstream and overstimulate the immune system. And now we see symptoms. We start seeing allergies, ear infections, chewing at the feet, behavior issues. So you can see how this is all a cascade effect. And two, this can also overload the liver. The liver is having to process all of these toxins. So if all these toxins are now passing through, not only is it still having to do its normal jobs, but it's now having to deal with that. And so that liver is a huge part of supporting when we're looking at how do we heal these, how do we fix the root imbalance. And one of the things that I follow, and this goes with, you're going to see similar themes with each of these pillars, is thinking about 5 R's. We have 4 R's here. We're going to talk about reset with emotional health, but the remove, the replace, the re-inoculate, the repair. When we follow this path and this framework, we end up with a healthy gut. So I want to talk about Leo. Leo's one of my patients. He's a 2-year-old neutered male Labradoodle. Came to me 1 year in having trouble gaining weight. He was having bloody diarrhea, vomiting episodes, all these ear infections, allergies, not wanting to eat. And he was also like really hyper reactive. Like, it's great to have an excited dog, but when it's like super reactive, not good, right? And what did the vets do for him? He was put on a hypoallergenic prescription diet, omeprazole, so your proton pump inhibitor, and Tylenol powder. Tylenol powder is also an antibiotic, so similar to, works not the same as metronidazole, but it's an antibiotic specific for gut health issues. Here's the thing, Leo was still having health issues. So we had to take a step back and go, okay, we're seeing these symptoms. This is the check engine light. Let's take a step back, open up the hood, and let's take a look. So looking at the prescription diet that he had been on for quite a long time as a puppy, which broke my heart, we take a look at the ingredient list. This is part of the removal phase, that first phase. How can we improve their systems? How do we remove the things that are creating more inflammation in the body? As you can see here, this diet is not very nutrient dense or rich. It's supposed to be a limited ingredient diet, but not optimal. Especially from a food therapy perspective, when we start looking at Chinese medicine and food energetics, which we teach in our program, is he's a hot dog. Look at his tongue. Look how red that tongue is. He's got a lot of heat in his body. We've got bloody diarrhea, which is usually a sign of damp heat in Chinese medicine. We've got allergies, hot red ears. He's not tolerating heat well. And we're using venison. We're using potatoes. Venison is a very hot, warming protein. So one of the things here, if you have an allergy dog or a cat, making sure that we're assessing the energetics of food to make sure that we aren't inappropriately, without knowing, adding in more heat into the body that they now have to deal with. So for Leo, we want to find where are some of these other imbalances through some of the testing. So we looked at the microbiome, GI inflammation. There's lots of stool tests we can do through animal biome, innovative pet lab, vitamin mineral deficiencies through hair tissue mineral analysis tests, also looking at heavy metals with hair tissue mineral analysis tests, and thyroid. And we found lots of issues where we had heavy metal issues. He was okay with his thyroid. We had microbiome deficiencies. And so we can follow this healthy pet blueprint when we look at, okay, we have a much better idea where these imbalances are. Now we can follow this framework of removing, replacing, repairing, re-inoculating, and resetting. And by following this, it doesn't mean we have to add 300 things at once, but we can better assess where those deficiencies are for our pet so we can fix them. And I can tell you right now, Leo's doing amazing. He's on a homemade diet that's balanced for him, and he hasn't had any recurrence of his GI issues, and he's much more balanced emotionally. That is the power of taking a step back and reassessing why things are happening. So how would knowing like what was creating that gut health symptom affect your pet's treatment protocol and the outcome? You can type it in the chat box. So I want you to be thinking about when we're eliminating the guessing game and we're understanding how everything is connected, we have reduced time to heal, less vet visits and vet bills, more confidence. You are more confident in what you are using and doing. You typically have fewer supplements because we don't need to use them for the life of the pet. And your pet, the best part, your pet is healthier. So looking at this blueprint and putting it into these pillars for each one that we talk about, what can you remove? So tests for remove inflammatory foods, processed diets, test and treat for chronic infections, test the gut microbiome. What's the stress that's going on, the inflammatory chemicals that might be in the environment? What can we replace? Digestive aids using herbs, enzymes, microbes, vitamins, minerals if they're deficient, stress-free environment. Re-inoculate. Okay, pre-probiotics if necessary, postbiotics. There's some testing we can do. Food therapy to feed the good bacteria, feed that microbiome, reduce inflammation and heal. And then that repair phase, supplement with nutraceuticals and vitamins that heal that gut lining, supportive foods and supplements, looking at how do we repair the environment? Maybe there's a lot we need to do with stress. Maybe we need to create routines and repairing that mitochondrial function. These are the energy powerhouses in the cell, and we become more deficient over time. And if we do, we start losing that energy, repairing those detox functions so that the body's not just restoring toxins. So keep this in mind as we go through the rest of the pillars. Now, pillar 2 is emotional health. This is going to be closely connected to everything. All of these pillars are intimately connected with one another. So gut health, especially physical health. And here's the thing, a commonly missed root issue is your emotional health and the family dynamic. It is this interconnectedness is why so many pets have the same health condition as the pet parent. So who here, I'm interested, Who here has the same health issue that your pet currently has? Hands up. Okay. I knew there was going to be some people. It's very, 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 very common. So common. I'm actually never surprised when the client tells me that they have the same health issue as their pet because of this, because of that emotional health component and pillar. So this is the reset phase. This brings us into that fifth R, where we need to be looking at that gut microbiome, brain axis. It's not like the microbiome and the gut health is by itself in the body. It is intimately connected to the brain via the vagus nerve. So that cranial nerve 10, there is constant communication back and forth, and the microbiome should be producing your neurotransmitters, things like serotonin, short chain fatty acids, GABA, norepinephrine, and it's constantly going back and forth. So if we have things that are off, we're going to have problems in other areas. And stressors can come in many forms: environment, physical, psychological. For example, we have 3 cats. It's always a matter of assessing our environment to make sure our cats' needs are being met so that they don't start redirecting on each other or having aggression issues. And one of the things here is I want you to think about the impact of stress. Take a second. This is your moment. Take a deep breath. Just in, out. Because do you feel like this? Maybe it's the end of your day right now. And you're like, God, that day sucked. It's really, really overwhelming. And you've just felt stressed. This is your ticket to take some time for a breath or two to ground yourself. Because the problem with chronic stress is that, for one, it directly impacts our pets, and 2, it's impacting our own health because of this direct connection with the gut health. And so when we go into this stress response where we become stressed all the time, we call that a sympathetic dominant state. That's that fight or flight response. And that can directly create leaky gut. So we talked about that earlier, where now all of a sudden we have inflammation in that one cell lining, thick lining, and we're getting bacteria, protozoa, fungi, toxins, food, all the things that shouldn't be passing through, directly hitting the immune system. It also impacts neurotransmitter productions. There's inflammatory cytokines, so mediators that are being produced. So inflammation is increasing. That can directly lead to the brain and create what we call brain on fire. And it can actually change the type of bacteria present in the gut too. So if you're noticing some of these signs of stress, so excessive vocalization, you have a cat meowing all night long. There could be numerous reasons, endocrine hormonal issues, but it could be a stress issue. If there's lack of grooming, over grooming, decreased appetite, changes in behavior, aggression, cats urinating outside the litter box, defecating outside the litter box, these can all be signs and symptoms of an emotional health imbalance, because this brain gut axis is directly connected to mental health. We see behavior problems. So if you have a pet that is exhibiting some of these issues, cognition issues, seizures, we can't forget about the gut and making sure that we're doing some testing if you can, or supporting it, because that will make the world of a difference for healing an emotional health issue. Now, the problem with the conventional solution is they typically, for example, behavior problem, we reach for a drug. So anti-anxiety medications, maybe they make some recommendations for supplements, your DAP, your Feel Away. There's, your Calm probiotic, that's a single strain. And maybe they make some household environmental changes. But when we look for the root imbalances of an emotional health issue, gut health is key. We also need to be assessing and taking a step back, looking for toxins, heavy metals, especially aluminum, which can cross the blood-brain barrier. Every single pet here, every single pet parent here, most likely has some element of mercury and aluminum in them. But if we don't know how high that is, it's really hard to know what the priority of treatment is. So this is where I really like doing hair tissue mineral analysis tests. So we know that stress in the household, this is a root imbalance. If we are missing that there's no routine, that it's chaotic in the house, that our pets don't have a safe, quiet place, we're going to have limited healing results. Physical health also plays a component. Who here feels better when you move, right? Anyone? Do you feel better when you move, when you exercise? Yeah. Okay, good. You are my people. So I know I feel better when I make sure I get my exercise in. I go for my walks. I get outside. I see the sunlight. And this is because we have a lymphatic system, which is engaged when we move. It is part of the detox pathway, and it's an essential component for getting those toxins out and moving things. And those detox pathways, if they're not open, the body's just going to restore them. It's going to have a really hard time, and it can increase inflammation in the body. So I wanted to bring Kai's story forward. Kai has been in my Blueprint program now for a year and 5 months. Kai has been on the journey with me from the beginning of the start. And he had severe OCD, separation anxiety. Mom literally cannot leave him alone for more than a few minutes at the house. That's a huge issue, right? You can't leave your house or your dog's going to just wreck it. He had parvo as a puppy. He has severe gut health imbalances, pathogen overgrowth, E. coli, Clostridium, all the things. He's had multiple rounds of antibiotics. And Kai's mom was actually told by the breeder to give him up, that he wasn't fixable. So keep that in mind. Maybe someone's heard that from someone with their own pet. Now, this is Kai's holistic journey, because it's a journey. We've been at this for almost a year and a half with him. We had to identify what the right testing was. We know we have some severe gut health issues just based on the symptoms, the parvo disease, the GI issues, the behavior issues. So we need to test the microbiome, animal biome, do some hormonal testing, make sure his thyroid's okay, because this started right from the beginning, day one. We did some hair tissue mineral analysis testing to see, are heavy metals a problem? How well are we digesting and absorbing the food? We also looking at estrogen and some other endocrine hormonal issues too. And then vitamin D testing, because a lot of times when pets are having chronic GI health problems, they're going to be deficient in vitamin D. So I highly recommend testing for that. And then we had to have those realistic expectations. This is a healing journey. We do not expect results within 1 week, 2 weeks. What we expect is that we are moving upwards, and we're going to have some little dips, but we bounce back faster. And those dips are fewer and far in between. And that's how we monitor how Kai is healing. And that's where the power of having a journal, to not get super frustrated, not quit when we have a dip. That journal will help guide you. And you're like, oh no, it's been like a month. Last time it was literally like 3 weeks between those episodes. And now we're going 4 weeks. Okay, we're making improvements. And it gives you momentum, and it helps you feel empowered and confident you're on the right path. So with Kai, we needed to treat those root causes. This involved healing his gut lining, making sure we're using the right supplements, adjusting his diet according to food therapy principles, making sure we're using appropriate supplementation to make sure that his inflammation is being lowered, that we're using behavioral training also for that separation anxiety. Supplements ain't going to cure that, but we can help his neurotransmitters, his microbiome, his gut health, all those other factors that are going to help with the training. And then also utilizing calming methods through acupressure points, massage therapy, tea touch, integrating calming teas like chamomile, lavender, to really help rebalance his system. And this is what Barbara today, Dr. Katie Woodley, you're amazing. She went back for her appointment, said the supplements you recommended are spot on. And she said, Kai has come a long way in the past few months. So this was a few months in. Kai is already making amazing progress. His diet's well balanced. The adjustments needed are minor, and he's doing so much better. Kai's doing even better today, where his anxiety levels are decreasing. He's actually wanting to play. He's less reactive with other dogs. And this is all part of that healing journey. Our next pillar we want to take a look at is environmental health. This is where I find a lot of pet parents start, and it's not just about detox. However, we need to be aware that there are a lot of toxins out there. We are definitely being exposed to 85,000 toxins a year. And there are a lot of chemicals, toxins, and every single person here will have a very different environment because of the products we're using on ourselves, what we're using in our own environment, what our neighbors are using, what our cities, what our towns, what our, all of this will play a part. And the importance of this pillar is to increase awareness around these things because they're invisible and they could be impairing your pet's health. And rather than putting our head in the sand and pretending they're not there, if we know that these exist, then we can do our best to avoid them, reduce them, and remove them. Removal is the first phase of our blueprint program. And that glyphosate, so Roundup, actually targets certain pathways in the gut microbes and the microbiome. 90% of rainwater in the world contains glyphosate. So even if you aren't using it, it's there. Processed pet food is very high in glyphosate. Flea and tick preventatives, vaccines, heavy metals, stress, mold, formaldehyde gassing off from flooring, new furniture, blood sugar, free radicals, oxidative stress. These are all things we need to be aware of so we can better support the body based on our individual circumstances. And this is, it's a crazy thing when we start looking at the glyphosate levels measured in urine. These are coming from dogs and cats that are on kibble-fed diets, and you can see how high those are. Pets that are fed raw food diets tend to have minimal because they're not being fed those grains that are sprayed or the corn. And then also too, looking at, I used to always say, whenever I got a pet that had bladder cancer, I always used to ask, do you live near a golf course? Because of the correlation. And there's a study that showcases that pets who live near golf courses have higher incidences of bladder cancer because of the amount of chemicals that they're being exposed to. Now, I know not everyone, if you live there and you're like, oh my God, I had no idea. Like, what do I do? Do I need to move? I know not everyone can move, but when you know about that, you can help them. You can support those detox pathways more frequently. So there's daily things that you can do to help them so they can eliminate those toxins and they're going to have less likely to have an impact on your health and your pet's health. The other thing too is becoming aware of a lot of these preventatives that are being pushed by veterinarians because they just don't know. I know it seems like, why don't they know? They should know. They just don't know. They don't realize these are neurotoxins. The education is not being pushed on them to showcase this. But when we know better, we can do better. We can ask for better. So making sure that you're aware of all the things that are going into your pet. So that way we're not increasing that toxic burden in the body. Now, conventional medicine, they tend to look at, high liver enzymes. Here's your Denamarin. So essentially we're using a supplement once again to treat a symptom. That's the conventional approach. Denamarin's a great supplement, can help lower liver enzymes, but we need to be asking why is that liver value elevated? Liver values don't just elevate for the fun of it. We need to understand why, because when we finish the Denamarin, if we didn't remove the thing or fix the root imbalance, those liver values are going to become elevated again, or even worse, something else is going to break in the body because it's all interconnected. Conventional blood tests don't always show what's not working in the body. And they're relying on, they don't have the right tests to find the root cause. Those aren't done. The vets may not even know about them. A lot of vets don't know about animal biome. They don't know who Innovative Pet Lab are. They don't know about VDI and vitamin D testing. They don't even know about sometimes B12 testing. So this is where learning these things to ask your veterinarian about or order the test, because there's a lot more tests now you can order on your own to truly identify the root imbalance is key. And look at the conventional medicine, routinely prescribing neurotoxins like flea and tick products. They're not asking why. So what's happening is we're using a supplement, we're allowing things to continue. And once again, we're on this spectrum of disease where if we continue to use the things that are aggravating the body, affecting the microbiome, impacting the liver and the ability to detox, we're going to move towards disease. And we stay stuck on that treadmill and not healing. This is my fin. And this is why this area is so important, and how I can relate to probably a lot of pet parents here, where I didn't know better. I didn't know to look for these things and didn't realize the importance of that. I thought we don't use these, we don't use these chemicals. Our house, we're very natural. I don't have chemical, like cleaning chemicals that we use in the house. We stopped using stuff on Finn when I became aware of things, back at the beginning of my journey. And we live in a town where they spray, where our neighbors, there's yellow flags everywhere. And because I now know better, I can help prevent things like brain tumors that cause those seizures that Finn developed. Glyphosate is directly connected. Well, I shouldn't say that. There is a potential correlation. I'll get blasted by by people if I say that. There's a lot of studies out there that show potential correlation with these chemicals creating a lot of cancers, autoimmune disease, a lot of health issues. And it makes 100% sense. And so when we know better, we can do better. We can take action. And this is where those detox pathways, it's not all about milk thistle. There's a lot of different pathways that we need to make sure are open. So when we're bringing fat soluble toxins in, we need to process them. We need to change them through the second phase, and then we need to eliminate them as a water soluble toxin through the kidneys, through the stool. So they're eliminated out with the bile and the kidneys out through the urine and the stool. That's the main elimination pathways. Things can also be eliminated through the skin. So if you have an itchy pet and we haven't addressed the environmental health concern, that pillar, and addressed, are we using chemicals? Are there other factors that are increasing inflammation, that toxic load on the liver? This is a great area to start in, because this can manifest as what looks like allergies, what looks like, everyone calls it yeast infections, but it's not. And that might be why you're stuck on the hamster wheel, where you're trying to treat the yeast, you're trying to heal the leaky gut, and it's actually a liver detox issue. So we need to use supplements or food or a combination, I like the combination of different things, to help open up all the pathways to get these toxins out so they don't get recirculated. And I think this analogy here is like, if those detox pathways aren't open, what happens? Like the toilet gets clogged, right? Things back up, inflammation increases, we have problems. And that gut is a major detox pathway. Your cat has constipation. If your dog has IBD, has problems with their stool, that is a major issue. It's not just the liver. If the kidneys, we have kidney disease, they're not able to filter out those toxins. Those toxins get recirculated, they'll get stored. The liver has to reprocess it. So we have to look at all of these pathways and how they're interconnected to make sure that we can truly detox. And here's Roper. So Roper again, he's a great example of how all these pillars of health come back together. So he's actually a 10-year-old neutered male Australian Shepherd. He had a history of chronic back pain, behavior issues. He's just anxious. He had a dry coat. He'd been on a raw diet his entire life, and he'd been receiving chiropractic adjustments for a year, every single week before I saw him, and his treatments weren't holding. So what's our first step? Got to take a step back. Okay, this dog, there's something missing, right? Like, this is crazy. There is something wrong that has been missed. And he had some x-rays done previously. There was nothing off. And so let's take a step back. Let's look through the records. Let's look at the blood test results. The power, by the way, of having your own vet records, so you can assess trends and you can go through it like I go through my clients' records, my patients' records. And I saw we needed to do full blood work with a thyroid. It had never been checked. Thyroid is one of the most commonly missed endocrine tests. That is the simplest test that should be tested every single year. So if you are here and you have a chronic health issue, this may save you a lot of heartache and also save you financially too. So you get off this horrible treadmill of going back and forth to the vet clinic for the same issue. Is request your records so you can go through them and see if a thyroid has ever been checked on the blood work. Because if it hasn't, that'd be my first step. We also started looking at his animal biome testing, looking at the microbiome. We did a hair tissue mineral analysis test. And, the owner had some financial concerns. So we just started with that to give us, a more general picture, see where potentially some of those root imbalances were. And what we found was he had an overgrowth of E. coli. His system and his gut was off. And so we were able to start treatment for that. His hair tissue mineral analysis test, he had major heavy metal issues. He was hypothyroid. He had a low thyroid, who knows for how long. So we actually treated that. And guess what? His behavior, his gut, everything started to improve. And his sessions with me, acupuncture wise, chiropractic, started working because his body started communicating with each other again, because that thyroid is a powerhouse for the entire endocrine system. And so this is just an example when we start treating the right issue. I could have happily just given him acupuncture week after week alongside his chiropractic, and it probably would have helped a bit, but I wouldn't have known he was at a really, really high level of aluminum, and we brought that down. So I want you to see the journey, right? We're still too high, but it's dropped by over half. And this is how all of these factors play a part. So we go back to that healthy pet blueprint where we're removing. He's in a farm, like a rural farming community. So how can we reduce the glyphosate exposure? Okay, let's use supplements that bind to that. How do we replace? Okay, we need more variety in the diet. Let's make sure there's a little bit of fiber to feed the beneficial bacteria, and making sure we're boosting things that are a little bit deficient on some of this testing, and using enzymes to help digest the food. We need to look at, how do we repair? We know that we have a dysbiosis. We know we have toxins. We know that things are inflamed. So we can use supplements to help heal that. We can re-inoculate using fecal transplant capsules. Great. Most powerful, most effective, rather than dabbling in probiotics. And we needed to reset the environment because there's a lot of stress with the other dog in the household. We need to manage the pet parent stress better. There's a lot of anxiety there. So providing tools to be able to help calm and ground are going to help this healing process, because everything's connected. So pillar 4, immune health. I want you to be asking, like, is my pet's immune system strong? Is it weak? Is it being overworked? And this is where that immune health, once again, all of these pillars are interconnected. Is everyone starting to see like the connections, the repeatability of this? Yes, great. Thank you for letting me know. Like, seeing these patterns. And once we take that step back, it almost hits you with like a board in the face where you're like, oh my God, I never thought about that. And with immune health, 70% of that immune system is intimately connected with the gut. So if we have a dysbiosis, we have an overgrowth of bad bacteria, that pet's immune system will be directly impacted. Now, here's the flip side. I'm not all about genetics as your destiny, because there's epigenetics where we can tweak and change how genes are expressed, nutrigenomics where we can use food to actually manipulate the expression of genes. But some pets are born with like what is it called? The short stick, right? Where they have weaker immune systems. They may not have a strong gut health. And so, German Shepherds specifically, they're known to be like potentially born with low immunoglobulin A, IgA. That's a very important immunoglobulin in that mucus lining. Others develop immune concerns because of an overload of toxins. If we continue to add stuff in, we're going to overload the body. And because everything is intimately connected, we're going to have a problem. This is one of the areas that I find most people are really uncomfortable with. So these are all about the conversations you're having at the vets regarding vaccines. Is my pet healthy enough to be vaccinated, or even need a vaccine, or can we do titers? Are you deworming your pets without checking a stool sample? Do they actually need this antibiotic for an ailment, or are there other options? Asking your veterinarian, why are we using this? Can be the simplest question. Why are we using this? It doesn't have to be, abrasive, but why are we using it? And if they can't give you an answer and they're just saying, because we're just trying to cover all our bases, I would take a step back and reassess. Are there other tests we can run to figure out why this is occurring? So having those questions to ask the veterinarian are very helpful. Also, are you using flea and tick conventional products? Are you using heartworm medications year round? And say you live in Colorado like I do, and it's like 10 degrees outside. Mosquitoes aren't going to survive. We don't need to use these things year round. And there are so many great natural alternatives that we can layer on that are much safer for our pets and less likely to cause an issue. Because here's the thing, these are the most common disorders of an immune dysfunction issue. Atopic disorders, so things like allergies, asthma, autoimmunity, so things like inflammatory bowel disease, thyroid disease, food sensitivities, cancer, chronic inflammation. So chronic inflammation, think about any disorder, inflammation tends to be at the root. And we need to also take another layer down and look at, well, why did that inflammation occur? What was off? And so if your pets have heart disease, kidney disease, osteoarthritis, if they are overweight, if they are obese, this is going to set up an issue with the immune system. So I wanted to share Spartacus's story. Spartacus has also been in my Blueprint program alongside Kai for the past almost year and a half. And he, once again, he came to us because we've had issues from day one. Spartacus as a cute little precious baby German Shepherd, behavior issues his entire life, GI sensitivities, so gastrointestinal sensitivities, food sensitivities, diarrhea. And mom is spending lots of money at the vet. She's not getting any answers. We're not seeing real improvements. And so what we did is, once again, work through that framework where we need to do the right testing. And two, take a step back and think about, okay, we have a behavior issue. Who here is thinking gut right away? Gut, right? Gut health. Yes. Yes, you guys are on it. Gut. Okay. Well, okay, we've had this issue from the beginning. What about the endocrine hormonal system? Thyroid. Okay, yep, let's make sure we test for that. Okay, we might have an adrenal gland issue. Okay, endocrine immune imbalances. Okay, let's think about, he's a German Shepherd. He might not be producing the right immunoglobulins in that immune system. Okay, so we can test for that. Now, here's the thing. If you can't test for those because you don't have access to the test or whatever reason, if it's a financial reason, think about it the way I just thought about it, because you can use specific supplements to heal these imbalances in the body and support them and monitor it in your journal. What's the response we're seeing physically? So going through that process, those frameworks, and looking at how those frameworks apply to the pillars can help guide you. So you're not just guessing, I'm using this supplement because Sally on the Facebook group said I should use this supplement, and I don't really know why I'm using it, but it worked for her dog. So maybe it works for my dog. So this gives you a better approach to help you feel more confident and really empowered about how you're working through the supplements, the foods, the things that you're using, and even the medications, right? Asking that vet why. So Bethany, Spartacus' mom, biggest positive impact that I've noticed right now is my new confidence and knowing that what I'm giving him, new supplements, is right for him. I don't feel like I'm guessing. I have new hope. Definitely feel like I am doing something different to help Sparty. I've seen a positive change in Spartacus. So these changes work, but remember, it's the journey. We are on a journey. There will be ups and downs as long as we're moving in the right direction and reflecting and responding to what they're showing us. And the last pillar that's commonly overlooked for the importance of it is physical health. And this is where asking yourself, is my pet's physical health mentally and physically potentially impacting other areas? So once again, these pillars of health are all connected to one another. And some of the common questions that come up with this area is, why can't I get my pet to lose weight? Who here thought that? Like, you've like lowered the food and you're like, oh my God, it's not working. I increased the exercise. Why is my pet still overweight? Like, I'm trying all the things. How do I get my cat to be more active when all they want to do is sleep? How do I help my older dog that can't move as much because of pain? And when we look at physical health, we have to once again look at what's going on in the microbiome. Are they digesting and absorbing the nutrients from their food? What type of food are we feeding? What's their nutrition, right? Inflammation, what's that level of inflammation? If they're too stiff and sore to move, we need to address that. We need to use nutraceuticals and foods that are going to help calm and bring that down. What's the brain function? the joints, the nervous system, that lymphatic system, which is such a key component of detoxification. So this is really important because you can reduce a lot of this inflammation that occurs and truly support the healing to help them live longer with less disease. Lifespan should be increasing because we have advances in medical care. We have greater knowledge and understanding about the nutrition, environmental, the emotional influences, and holistic options that we have available. When we incorporate all of these together, so things that we can use like curcumin, green tea extract, your bacopa, DHA, your sulforaphanes, things from like broccoli and broccoli sprouts, ashwagandha, all these things can slow down aging changes that are going to activate certain pathways and proteins in the body that reduce inflammation, help heal the microbiome, help that brain on fire that could potentially be occurring. But also, too, most importantly, when we implement it before we have a problem, before we get to that stage on that spectrum of disease where we have symptoms, we can actually prevent disease from occurring in the first place. And there's a lot of ways that we can support the physical body. So these are my own cat. Smokey has cerebellar hypoplasia. So he's a little bit wonky, but he doesn't have any impact to his quality of life. He loves his herb gardens. So putting down dried organic herbs, playing with him, engaging with him. With all of our cats, he's just fun to watch because he's all over the place. So he's super cute. And really utilizing some of these tools. And this is important because rather than guessing, which I'm sure a lot of people here probably feel like I'm just kind of guessing, I'm hoping that this works. You now know and can monitor the progress of what you're doing. And what this means is it saves you money by only using supplements that are needed, using the right foods to heal, and know that you're making a positive step in the right direction to actually healing your pet's root imbalances. So here's the thing to keep in mind. I know it can feel overwhelming, but when you have a partner to help guide you along the path, a holistic life becomes easier every step when we find those root causes. And so with my own family, we took one step each day. We built a foundation following these 5 pillars of that healthy, holistic pet blueprint that we went through. Each day getting stronger, less sick. And this is how my clients heal their pets following this blueprint. And, unfortunately, many make that mistake of starting with detox first. And keep in mind, if the gut is sluggish or if it's not functioning well, those toxins are going to get stuck. If we have nutrient deficiencies, detoxification and the immune system will not work well. Or if you're using a supplement or preventative, so flea and tick, that's actually creating inflammation, the body won't heal. So this is how you get results. I want you to remember why you attended this webinar in the first place. Going back to what is the symptom that we're here for? What is this frustrating thing that I can't seem to shake, with my dogs or my cats, or maybe even both? And shifting from that pill-based thinking to really system-based thinking, assessing all the 5 pillars of health to see where those gaps are currently, and testing when you can to figure out where those gaps are to help speed up the process for you. And then based on all of that information and assessment and observation, start implementing with the right foods and supplements to fill in those gaps. And here's something to keep in mind. I started with holistic medicine because my husband was sick. I went down the rabbit hole, hours and hours, years of research, additional certifications and degrees. And you may already have had a pet with allergies or another disease, and you've vowed to yourself to do everything possible to not go down that path again. Or you want to do everything possible to keep your current fur family healthy. The small steps and support from people who have been there before are so much more important than the naysayers and people who don't believe in your journey towards holistic medicine for your pets. Your time is now. You need solutions now. And here's the thing, this isn't just a theory. We've actually tested this entire system. You saw some of the patients that have come through that system, and it's proven its results with my own pets, the patients and clients that I've worked with. At this point, I know I can make greater impact by sharing it with more people, which is why I'm here today. The method's time tested, it's proven. And yes, holistic medicine can work to achieve optimal health, can help heal gut health issues, other health issues that you have. And I'm using these strategies on this webinar that you're on right now, plus so many others to help pets feel their best. So if you're thinking like, I'm ready, where do I start? All you have to do is commit, focus, take action, which you've already done. And I applaud you for taking time to be in this masterclass today. So I just gave you a brief glimpse at that Healthy Holistic Pet Blueprint Lifetime Program. But as I'm sure you can imagine, this is literally the very, very tip of the iceberg and the beginning of the journey when it comes to figuring out your pet's root imbalances and resolving them for good. So here's a couple of things you can do. You can either kind of stay stuck and try to figure it out on yourself and continue to take the time to see if it works, try this, try that, hoping that it fixes something. Or you can get the proven success path with support and guidance. Now, why? Why is this important? The biggest issues I see with the online pet health space is there's so much information out there. Each of them trying to teach an aspect of this intricate puzzle of holistic pet care. You might be in a Facebook group on why you shouldn't use conventional meds. It's not really helpful if you don't know how to safely and effectively use holistic medicine to truly treat the root imbalance. A supplement for gut health, that's great, but if the root imbalance is missed, inflammation continues. Lack of feedback from a professional with the training and tools to really help you dig in deeper. And so I wanted you to have the best possible launch pad for the healthiest, longest life for your entire fur family, because I've been through it. And I'm coming at this with years of experience, experimenting, finding the things, researching, learning the degrees, actually working long-term versus trends, to help you speed up the process so you don't have to go through 9 years of figuring it out like I had to do. Now, this is Jacqueline's dog, Luna, who came through our program. As a first-time dog owner, I wanted to learn everything I could to give my dog the best foundation. 2 years old, she didn't have many health issues, but had started developing allergies. The program gave me the roadmap I needed along with the individual support to get her to optimal health. Not only have her allergies resolved, but she seems happier and healthier all around. I feel more confident now in caring for her and have many tools if other issues arise in the future. I'm so thankful to have been able to learn from a vet that's incredibly knowledgeable, empowering, holistically minded. Jacqueline was able to heal Luna's allergies that had been going on for a long time in 6 weeks by following the frameworks to a T. That is how powerful it can be. These are a couple others. Really enjoyed working with Dr. Katie with my dog, Dave, a 9-year-old small long-haired Chihuahua who's actually so adorable, right? Dave has had chronic GI issues for 6 years. No one has been able to help him. It's been so frustrating. Dr. Katie's the only vet I've worked with that can place all the puzzle pieces together. Dave's doing really well after 6 weeks, and I look forward to continuing my journey with Dr. Katie. She's the best, dedicated, whip smart, logical, positive, and understanding her program is intuitive in all ways. Can't get better. If you're thinking of working with her, it's worth every penny. And then, of course, we talked about Spartacus with Bethany. This is another client that's also gone through the program with Buddy. So there were a few challenges I'd been dealing with that led me to choosing the health program. My Beagle mix Buddy is almost 12, has struggled with digestive issues for years. It's not been an easy journey for us at all, trying to seek help from conventional and integrative veterinarians. I'm very grateful to have found Dr. Katie in this program. It's positively impacted us by giving us real hope, real results. Instead of looking back, for once I'm looking forward with confidence. The results I've seen from completing the program have changed our lives. My Buddy is now eating well on a good diet and feeling better. His inappetence through the years has been a major problem, so much so that I almost lost him 2.5 years ago. I know his immune system, digestive system are so much better now from working through the program. Dr. Katie's provided me with the knowledge and positivity I need to continue Buddy's plan to his best health. I'm so glad I never gave up and I found her to help us. She's caring, patient, helpful, very knowledgeable. I would highly recommend for anyone to invest in this program. There's so much wonderful information provided that can truly transform the lives of our pets and also give us the emotional strength we need to care for them. While I thought in the past I had found solutions, I was not on the right path. I've been surprised throughout the program to learn so much and apply it to help my buddy. And then Donna with Gigi, highly recommend Dr. Katie. We essentially got Gigi back to optimal health, fixed her gut health issues, and she has a balanced gut microbiome. So these are just quite a few of our testimonials from some of the members that have gone through and are currently in our program, where they needed help, they needed support. And they were on that path of going back and forth to the vet clinic, not finding the solutions, not finding the answers, and spending a lot of money and watching their pets get worse and worse, and that worry and the frustration. So my dream pet parent is someone that wants to do everything possible to achieve optimal health, heal those root imbalances. They love learning and participating. They're not afraid to ask questions. They're kind to others. They love being a part of a community. Their fur family's health is as important as their own, wants all the options and loves getting results. They're not afraid to try things that are a little uncomfortable, and they like taking action, and they know holistic medicine is a journey. So I want to ask you, are you next? And here's the thing. The better the fit, the better the results. And I want to make sure the right pet parents who are ready to believe and change their thought process, take action, and truly want results. So who here wants in? Who here wants to learn how this process works? So this is for pet parents, pet store owners, trainers, people who want to learn more about holistic medicine and find the root causes of why disease occurs. This is also for pet parents who want lifelong health for their fur family and not just quick fixes. They understand that investing in your growth, education, having skin in the game is the only way to truly grow and not stay stuck on that treadmill. And this is for people who are action takers and are actually going to implement the information, know this journey, and know it's not necessarily an overnight success. It is truly a holistic journey. But this is for those pet parents, those people who are frustrated, worried, overwhelmed, watching their pets not heal, not get better, that know there's something more out there. This program is able to take you to confidence, empower you, and support you. So if this sounds like you're invited to set up an interview to see if our Healthy Holistic Pet Lifetime Blueprint program is the right fit for you. So I personally set aside time in the next 14 days to talk to you and see if we can help. You're actually going to probably have an email in your inbox right now with a link to schedule an interview with me. The call's approximately 45 minutes. The intention is to understand where you're at with your pet's health and identify how and if we're a fit to work together inside our lifetime program. So this is a paid program. It is for lifetime support and mentorship from me, a holistic veterinarian, through weekly Q&As, educational frameworks following the blueprint and the pillars of health to help guide you to fix the root imbalances and prevent disease, and a private community for further support to ask questions and get help so that you can truly get the health results that you're needing and wanting for your pets. So this is an overview of our program where you're going to have lifetime access. So if you've been wondering, like, I don't have access to a holistic vet, this is so frustrating, there's not enough of them, this is the solution to the problem, where now you can get the feedback, the support, the guidance on how to use holistic medicine to heal those root imbalances. There's an entire educational video content program that takes you through those 5 pillars of health so that you can learn why and how to make the changes specific to your pets to heal the root imbalances and prevent disease from occurring. We have weekly Q&As with myself for life, for your current and any future pets, where you can ask specific questions, get further guidance, and essentially show up and learn even more about how the body works and how we can heal it and prevent disease. And there's also a private small community that's moderated by myself for further support and help with other amazing like-minded pet parents. You saw some of them that are part of the community with our case studies. They have similar health concerns. They are on same journey. So you never have to feel alone again trying to figure this out. And then of course, you'll always have access to content upgrades, bonus webinars that are a part of it too. But you might be thinking like, but what about, right? I've already tried a ton of different supplements, herbs, and diets. This program is different because we take a deep dive into looking at how food therapy can be used, how the microbiome, what foods we need to feed, what are those different supplements. It's not just about what's the next supplement. It's about why are we using something? Why do we have a symptom? And being able to work backwards so that we can actually truly heal the root imbalance. So you're not just throwing spaghetti at the wall and hoping it sticks. So why is this different than other things online? This program's different because there's not really anything like it out there. And what's important about this is that there's not enough holistic vets. We need more options for pet parents to have access to learn why things go wrong, how to shift our mindsets, to also be able to feel empowered to go to the vet clinic with the right tools, the right research articles, the right questions. So this is really a program to empower you, to help you feel confident and support you. And it's a lifetime program. So once you're in forever to have support, guidance, and help so that you're never alone again. And then how do I know this is going to work for my pets? It's just like anything, right? You put the time, the energy, you ask the questions, you will get support and guidance and help for your pets. And so this is where the amount of pet parents we've had in our program that have gone through and done the work, it's a pretty amazing to see the results. And if you put the time in and you learn and you ask the questions, I am here to support and guide you along that way. And you might be asking, how is this better than a one-on-one, right? Well, unfortunately, we're losing vets by the day. There's not enough holistic vets. And I also find that by being able to intimately connect with my community every single week, every single day, answering questions, supporting them, giving feedback, guidance, I get to know you really, really well. I get to know your pets really, really well. And we end up getting better results because we can fine tune and adjust and tweak things much faster than having to wait for an appointment. So we get better results in a group setting. It also helps you because you can learn from other pet parents. And the best part of learning, I found this along my journey, if I can learn from someone else and avoid the mistakes they made on that journey, it will speed up your process. And the other question you might be wondering is, will I be able to ask personal pet questions? 100%. So personal pet questions, any of your pets, when you come into this program, your entire family comes in. So if you have 15 dogs, you can ask questions about your 15 dogs. You can get support and guidance for them. If down the road you decide to bring in a new kitten, you have now the educational framework to get them on the right path so we can prevent disease in the first place from even occurring, and ask questions about what you should be looking for. So those are some just ideas of how we've been able to support and help the pet parents that are currently in our community. So I hope that helps. And two, the final question you might be asking is, can I ask questions about any of my pets? 100%. Kind of answered that in the last one. So this Healthy Holistic Pet Blueprint program is for you if you're ready for that change. You want to make 2023 the year you take back control of your pet's health. We are halfway through the beginning of a new year. And I know a lot of people set commitments for optimal health, taking back control, fixing things. And, this program is going to help you take back control and feel confident again that you are on the right path. This is also for you if you're done with only treating symptoms and missing the root cause. This is for you if you want to dive in deep and commit to a true holistic journey. If you want to feel confident, empowered, and supported again by a holistic veterinarian, literally for life. and you want those lasting results for all your pets, that comes with lifetime support with a holistic veterinarian, incredible pet parent community, so that you know you're doing everything you can to help your pets feel their best. So it comes back full circle, right? We can't always see the forest for the trees. So I want to ask you, do you feel like those trees are blocking your view from seeing the entire forest? This is like staying stuck on that treadmill and not being able to see the bigger picture and only focusing on those symptoms. And this is where the Healthy Holistic Pet Blueprint is your ticket off that treadmill into finally fixing the root imbalance. And so this is the link to schedule a call now. There are a lot of people on the masterclass that will be getting the replays, and our schedule can only handle a limited number of calls a day. So I highly recommend, if you are ready for a change, if you are ready to commit to that holistic journey so that you can wake up, feel confident and supported and truly empowered, that you are taking health back into your hands to help your pets and heal them and resolve those problems, schedule a call. Learn more about the program, see how it can fit in with your life and how it can benefit you and give you back that peace of mind that your pets are healthy. And I want you to keep in mind, your pet's health is an investment. It's not an expense. I've been there on this journey with my husband, with my pets, and when things go wrong, it becomes an expense. So if we can take back control and truly treat the root imbalances, that investment is so worth it. So, and here's what I know to be true. I would not be where I am today without investing and working with the people who were where I wanted to be. So once again, I want to ask you, where do you want to be in 1 year with your fur family's health? Write it down. When we write it down, it helps solidify it. Whether or not you schedule a call or not, I want that to be your focus, especially for 2023. So once again, that link's there, schedule a call. And what I'm going to do now is I'm actually going to go through some questions. Keep in mind, you also most likely have an email in your inbox right now to be able to schedule a call too. There is a short application that you need to fill out, or else it won't let you schedule a call. So go through that as completely as possible. Also, if you do want to schedule a call, but for any questions, put them in the Q&A box, because there's a lot of comments in the chat that I'm going to miss things. So this is where put your questions into the Q&A for everyone. So go there, because I will not be able to go through both because we have quite a few questions, but let's go through some of the questions now and answer those that have come up. All right. Let's start there. Let's see. Okay. So Terry, my dog is missing 9 different beneficial strains of good bacteria. Can this be replenished and restored even if they were never there in the first place through pre, pro, and postbiotics, or is a fecal transplant the only way to do this? So if they were never there in the first place, I don't know if we can truly know that. I know when we do animal biome testing, so animal biome test is a stool test that looks at the microbiome. And this is where, when we look at that, if it says like they're not there, it doesn't necessarily mean that they're not there. On the human side, there's more studies about this where we can potentially kind of revive them and feed them. And I've seen a lot of pets regain optimal microbiome health in terms of not being able to access fecal transplant capsules, because not everyone can access those. So this is something where if you can't access that, then your next best bet is a prebiotic. So that's the food source. So those are things like inulin, your FOS, your MOS, your arabinogalactin, so your large arabinogalactin. Those are all your food sources for the microbiome. This is also why too, like psyllium husk can be beneficial because it's feeding the good bacteria. And then your probiotics, the downside with probiotics is that when we think about how many colony forming units, so you'll see this on the label, CFUs, those are the concentration of the amount of the bacteria, the number of bacteria that are going to be typically should be within that capsule. Now, keep in mind, a lot of probiotics are dead. They're not truly alive. And most of them come in like a billion CFUs, 10 billion, 1 billion. And so when we think about the entire ecosystem, there's trillions of microorganisms that exist in that ecosystem. So we can't rely on probiotics to essentially inoculate the gut, but they can have immunomodulating. So they can modulate things. They just might not, like when I say inoculate, stay there and populate. And then our postbiotics are going to be things like your short chain fatty acids. These are the things that are being produced by the beneficial bacteria. So this is something that we talk a lot about, and it's actually in our module 2 for our gut health and nutrition module, so our pillar of health, where we talk about what are certain food sources, how do you feed the microbiome, how do we produce these short chain fatty acids and those postbiotics, and how to utilize some of that when we're looking at healing leaky gut, because butyrate is one of those short chain fatty acids that's really important. So I would say it's not 100% like you have to do a fecal transplant. Fecal transplants can be beneficial and very helpful because we're taking that ecosystem and putting it back into the pet that needs it. So there's a lot of different ways to approach it because not everyone's had access to fecal transplants, but it can be a good tool to use. Let's see, that's not really a question. Okay, Pauline, my shepherd regularly gets loose stools. I think it's from drinking from the creek, but there must be something I can do for her. I've been feeding her a raw breed appropriate, I'm told, diet, but now she's refusing it. I can see me going down a track which doesn't help her, and I don't want that. Any ideas would help. This is very common, Pauline. This is a great question. And this is something that we definitely cover in the program. And as you can see, we have people that, Spartacus is a great example. Kai is a great example of current members in the Blueprint program where following these principles. So with shepherds, I love shepherds, by the way. I'm biased because of Finn. They can be prone to things like low IgA, which is going to directly impact the immune system in the gut. And two, my first questions, so taking a step back before we go like really, really deep, is I always ask, we go through that blueprint program or the blueprint that I talked about, where we're looking at what's that first phase? Removal, right? So have we truly tested for things like parasites, for Giardia? So we need to be going back and making sure that we've truly ruled out a pathogen because they're so common, especially if the dog's going and drinking in the water, they're bathing a lot, they're going to dog parks, then of course pathogens is a lot higher on the list. And we need to make sure that we are ruling that out. There's a lot of ways you can naturally treat that. We have recommendations in our program for different like herbal formulations and things like that can help. The other thing too, from a food therapy perspective, when we look at the body from a Chinese medicine perspective and using food therapy, the energetics of food, when we have loose stools or if we have an older pet, sometimes those raw food diets can be a lot harder to digest. So not every pet does well with a raw diet. I'm always like a big advocate for fresh food diets, but not every pet does well with raw. It is very cooling energetically. And if spleen's digestion in Chinese medicine is deficient and it's not working as well as it should, sometimes we actually just need to add a little bit of heat to the diet and also lightly cook it. So that would be something that would be an easy adjustment that you can make to see if you haven't done that, is just lightly cook the food, make sure we're ruling out pathogens, and then go down the path of some of the things that we talked about. There will be a recording of this, so you will get this sent out probably in a few hours time in your email. So don't worry, you can re-listen because I tend to go long in these. I think I said 45 minutes in the thing. We're at an hour and 45 minutes. Give it up for everyone who's still here. You guys are amazing. All right, Terry. Great question, Maya. I'm going to say your name wrong. I apologize. Mariah Boy 12. Will we be able to post test results and will you comment on them? 100%. So what we do in the program, and this is something where there's always a lot of concerns around like, oh my gosh, this isn't the same as one-on-one. I'm just going to get lost in a group, right? And one of the big things that I don't want you to worry about when you come into this program is that you get lost. You get lost in a crowd. And our community, I call it our family, just because we're so close-knit, cheering each other on. whenever you get a test result and you're not sure about it, in our community, you can actually so it's not on Facebook, it's on a separate easy to use platform, very easy to use. You can actually post, pictures and things like that. So I have people post the pertinent information from those test results they have a question on, and we can actually have a conversation back and forth. You can also submit questions each week. So that way I'm answering those live. We can have a conversation live. So it's essentially kind of like a one-on-one. And we've been able to guide and help pet parents where they've been able to avoid ER visits. They've been able to heal. We have a cat that was resolved with asthma by using the right supplements and using food therapy. So that was really neat to see when, they were worried about steroids. We've been able to help get pets off of steroids. We've been able to get pets off of Apoquel and Cytopoint by guiding them through that, by following those pillars that you just kind of briefly touched on during this webinar, and really helping them and fine tuning their treatments. So as you are taking action and implementing, you're able to ask those questions as they come up. Like, I started this supplement, I noticed a little bit of gassiness. Should I continue or what should I do? And you can tag me. So that's the power of being able to have a group coaching and a community and the ability to ask questions for the lifetime, for my lifetime. I'm young, so I should be around for a long time. And I love teaching and educating, and also seeing you get the transformation that you're here to get, seeing your pets thrive, and seeing you come in frustrated, right? Like, who here is frustrated? Who here feels like there's something missed, right? That frustration, the confusion, that overwhelm. Watching people transform as they enter our community is the best blessing I have been given in my entire career. Like, so my commitment to you is to guide you, help you, support you. Once again, it comes down to the actions that you take and how deep you go. And I can't control that. So, but I am here to truly support you and guide you. I hope that helps with that question. Glyphosate in water, that's sobering. I know, right? Annie, I was so disappointed when I was like, I'm literally being rained on by glyphosate. But here's the thing. So any filtration options, detox recommendations, when we know better, we can do better. And there's a lot of great water filtration systems. So we use Berkey, if you can invest in a reverse osmosis system, fantastic. And then two, using detox recommendations. So on our entire, one of the pillars is environmental health. And so we go through those different phases of detoxification and what you should be doing and how to assess your personal situation. So you can look at your environment and go, I live in a really toxic environment, like I do, unfortunately, not internally, but once I step outside of this house, I can't control all those things. But what I can control is making sure that I'm using binders, I'm supporting my liver, I'm eating healthy, I'm keeping hydrated. And these are all similar principles we can apply for our pets, our dogs, and our cats. So that's what I teach you how to do. So that way we can combat some of this stuff that we can't always control, but we can at least decrease the impact that it can have on our health. Richard, this is a great question. What causes elevated aluminum in dogs? Once again, we live in a toxic world. It's not meant to scare us. It's once we learn, we can do better. And so heavy metals are naturally in the ground. They're around us. Aluminum can be in the water. It can be in the bowls. It can be in the materials that we cook food in. So it's one of those things where if we're worried about the other thing aluminum is in, because I know every dog has mercury and aluminum, it's used as an adjuvant in vaccines. And so it's not a surprise that we see it elevated in a lot of pets. It can be in medications. Unfortunately, it can be in a lot of things. It can also be in the food supply. So when we look at chickens, and when they're raised intensively, unfortunately, the food that they're being fed can be high in heavy metals. It can be high in glyphosate, which is also going to bind to heavy metals and bring them into the body. So glyphosate is just like the devil in my eyes. I hate it. Feel like it killed my animals with cancer. But here's the thing. I now know better. So my 3 cats, they are routinely getting things to help them detoxify while I'm supporting their microbiome, while I'm supporting their physical health by enriching their environments. So all of those factors play a huge part. And we can only do the best we can, right? But it can come from a lot of different areas. Liz, how many people are currently in the program? So we currently have 90 members in our program. And so you're able to still ask questions. Our Q&As are 2 hours every week. And as the program grows, those Q&As grow. So don't worry. The program adapts to the people that we have in it and the support systems that we have to support you to get the results. Because once again, the commitment is from me to you that you will get the support and results that you're looking for if you take the action when you enter our program. Jay Vasquez. Thank you for this valuable information. Jay, thank you so much for being here and taking time. I know time is very valuable for people, so I appreciate everyone, especially everyone who's still here live. Thank you. You mentioned raw diet. Are you a proponent of this? And is this part of the holistic program? 100% a part of raw food diets. So I believe in fresh food diets. I know not every pet parent can feed a fresh food diet, whether it's budget, whatever reason. So we offer solutions for the spectrum of diets, but there is trainings on how to balance diets. I formulate raw food diets, formulated raw food diets for growth and, for senior pets. And there's a lot of knowledge and information on food because it's a key component, right? It's a pillar of health. So raw food diets are 100% part of this program alongside lightly cooked. And then if you need to use other diets, that is something definitely that is part of it too, because I know, once again, not everyone can necessarily afford a raw food diet or do a raw food diet. And some pets can't tolerate raw food diets. Patchery, have you treated cats? I know you had lots of dogs. So what's ironic, I attract cat people and dog people, obviously. And I have 3 cats. I've had, my German Shepherd and 2 other cats previously. And we have a lot of cat parents in the community, which is super awesome. I love it because I talk a lot about cat health because cats are truly underrepresented. So the program details cats and dogs because both need as much help as we can give them from a holistic perspective. So we have a lot of cat parents in the group. We actually have a lot of cat pet parents that do TNR, so trap, neuter, rescues, part of rescues, and helping adopt. And so it's a really, really neat community, a blend of a lot of different types of pet professionals and people who are just, holistic health practitioners, people who just want the best for their pets and are truly invested. It's just such an awesome community. Ashley, if one does not have enough time to make homemade food, or Honest Kitchen, Grandma Lucy's good options. I can't give specifics like without more information because each pet is so different. Those 2 brands though are pretty good. So some pets may not do well with Honest Kitchen because it's dehydrated. So it can cause some gassiness for sensitive pets. But you can always try these. And if you see problems, that's a sign like, uh-oh, we have sensitivity. We need to focus on these pillars and figure out why is that happening, adjust the diet, transition over. Bridget, what can be done for cats with kidney issues or preferably prevent it? I've lost 3 cats to kidney issues. I've just adopted one who's at the age when it seems to come up. I'm sorry, Bridget, that you've lost cats to kidney issues. It's so hard to lose pets to any chronic health issue. So I send my sympathy for that. This is where this entire program is built around how to find the root imbalances. But here's the flip side to that. When you know what the root imbalances are of diseases, you can proactively strengthen those pillars to prevent disease from occurring. So that is the power of this. So when we take a step back and we look at how do we truly optimize health, it's when those pillars start falling apart, when we start seeing issues. So a lot of times with cats with kidney issues, it can start with the diet. It can start with the microbiome. We have inflammation. If we have toxins. So looking at all of these pillars and how they're interconnected, when this is what I've done for my own cats, we adopted a rescue senior cat who has some kidney stuff. So I use supplements that support her kidney health because I know, and I make sure we use supplements that help detoxify. And then when we adopted Moki as a kitten, I put him straight onto a raw food diet. I used things that supported his immune system as he was growing and developing. So there's different tactics we can take that I teach during this program that can help you to help prevent those issues that you've had in the past from occurring with your your current pets. We can't always prevent everything, right? We can do everything right. Things can still happen, but I truly believe when that happens, we were able to extend our pets' lives. And I always look at what would have happened if I hadn't done that. That's how I look at Finn. Like, he got a brain tumor. That was awful. But I look at, what if I hadn't started him on those herbs, the fresh food diet, the supplements, way before? He probably would have gotten the brain tumor sooner. And for one, he wouldn't have done as well as he did. No one knew he had a brain tumor, and we got another year of good quality of life. So that's how I look at that. So if you've had something where you're like, I've done everything right and it still went wrong, flip the switch. Imagine what would have happened if you hadn't done all of that. You probably would have had less quality time. Your quality of life would have been lower too. So awesome. So once again, application process, that link is there for everyone. Just briefly before I go through the final questions that were submitted. And it is an application process. It is not a fit for everyone. And that's why we do the calls, to make sure it's a good fit for what you're looking for. So schedule that call. If there's any concerns where they're all filled up and you don't have a slot or space, just send an email to us. Stephanie, question about heartworm. I live in an endemic zone. Is it necessary to give every 30 days the preventative? So I actually have a YouTube video on heartworm prevention. So Dr. Katie Woodley, the natural pet doctor. Stephanie, if you haven't watched that, highly recommend it. The treatment, so I say treatment, when we say preventative, it's actually treating the last 55 days of heartworm. And so you can actually go every 45 days and make sure you are supporting detox, you are supporting gut health. Heartworm preventatives or treatments technically, are one of the ones that a lot of holistic vets are not comfortable not giving, especially if you are in a high risk area. Now, if you live in an area like Colorado, so where I'm at, we do get a lot of mosquitoes in the summertime. We do have heartworm. We get a lot of rescue dogs that come in from elsewhere to Colorado, and they can be heartworm positive and be carriers for the mosquitoes to pass it on to other dogs as the vector. There is no need to use it year round. And so if you have seasonal changes and there's a temperature difference, make sure you watch that webinar, and I'll post it in the Facebook feed. So that way you can see it. But if you just go to Dr. Katie Woodley, the natural pet doctor on YouTube, and you search heartworm, it'll pop right up for you. So you can check that out. All right. Lori, this is my third cat with hyperthyroid. I'm confused about what to feed him because he has CKD. I watched the phosphorus, but no protein, low protein, etc. So with hyperthyroidism, this is something we talk about because looking at immune health, detoxification, there's a lot of correlations with heavy metals, with vaccines, with fish. So toxins that are in the food that can actually predispose our cats to hyperthyroidism. And it just depends on the stage of kidney disease. But there's a lot of great foods out there that we talk about in the program itself. And this would be something too, where being able to like ask more specific questions and like post like, where your cat's at in terms of kidney disease, I'd be able to better help guide you. Let's see. Great question. Jay Vasquez. Hello again. We live in the UK. Is the program available to us? Yes, we have pet parents all across the globe that are a part of this program, from Australia, Singapore. We have France, we have the UK, I'm trying to think of all the different places, lots in Canada, Mexico, Puerto Rico. Yeah, that's the UK. I think I mentioned that already. Here's the thing. That's the beauty of a group setting. So just because you don't have a local holistic veterinarian near you, the ability to ask those questions and take action and implement. I guide so many pet parents on the questions to ask their veterinarian. So if you do need to go, you still need a conventional vet to do the other things. So it's essentially like having a team of veterinarians to help guide you and support you. So that way you're not missing something. So yeah, you'd be joining a group of international pet parents. And everything's recorded too. But yeah, if you have questions or you're feeling like, yeah, this sounds great, I just don't know, schedule a call and we'll get together and learn a little bit more about, where you're at, what you're looking for, and actually see if the program itself is a good fit for you. All right, everyone. That is the last question I have submitted that's relatable to the program. And I appreciate all of you. I see quite a bit of you still here live, and I thank you for your time. It means the world to me that you truly care about learning about this different world of medicine, wanting the best for your pets. And I would love to be a part of your holistic pet care journey if you're feeling called to take action on something like this and become a part of our amazing community and learn more, grow more together, and really dive in deep and figure out what is causing these health issues so that way we can get them back to optimal health and get you feeling confident and supported again. All right, everyone. Once again, you will get a replay. So stay tuned for that, but you should also have an email in your inbox with that link to schedule a call for the interview to learn more and apply for our Healthy Pet for Life Blueprint program. All right, take care, everyone. Have a good evening. Bye.